Yeah.
Hello everyone, my name is Malaka and I'm also doing a PhD here. I'm doing my PhD here and from Ethiopia, history actually, so working on the climate app for the Ethiopian. Thank you.
And I think we are super lucky to have this great community. So it's not that we are making things here in isolation, but we're really being closely in the country and being able to see how things can be used. Okay. So just I will not talk about the same I did in the plenary, but just to stress this with the climate services, and I think we could have this as a little exercise for today that you could think about. Is this on? Yeah. You could think about what sort of climate services you could build on top of climate data, and then we could have a little session on that at the end. Could also mention that, especially on this cross-sector collaboration, that we think that is crucial. And we are a little bit not worried because I think in the countries it's worked very well with this collaboration, especially with the Met Office. But just as because we have made these global data sets accessible very easily, it can be easy also to bypass the local expertise that you have, the local Met Offices. But that is really crucial, even though if you use this global data, because maybe it's hard to provide this data locally, it's very important to get them on board. And also just because we have different global data sets available, just to get their opinion on what would be better than the other to use, for example, between the chips and the ERA5. So, and I wanted to challenge also Patrick to tell a bit how you've been working with the Met Office in Uganda.
Yeah, so I think it's really crucial, as John said, that it's important to make sure that for climate service to actually work in the country, that you have the key people. And for climate service for health, definitely you need to have the health and then meteorology as key stakeholders for this to work. And for Uganda, it has been a very interesting experience, and I'm sure also for many other countries. As Bjorn mentioned, this product we're using here is global. And so if you import that to DHIS2, you're running that within the Ministry of Health, and you are taking this data to a level where you want health programs in country to use this data, and you are maybe like sharing this data, say with the commissioner or the ministry at a very senior level, definitely the question arises, where is this data coming from? You know, where is metrology? Has metrology okayed this? So from the get-go, having metrology on board is very important because first, of course, to make sure that they are kind of approved that what you're working with is okay, because they indeed work with some of the global data sets to be able to do most of the forecasting and all the other analysis. And so then approving this is very, very important, and that requires that working collaboration with metrology. And for Uganda, we've had a bit of a process on that, and we've reached a level where we've done even validation. We've been able to compare local data with the global data, and for now we've agreed that no, as long as we have local data, it takes priority, but second option. So we kind of agreed on what should be the first option in case we have local data. We definitely the first option, second option, and like so. That process is very, very important. And then along the way, moving with metrology is very important in the projects that you do, because they have the mandate when it comes to climate in country. Yeah, thanks.
So later on, you already had Lara presenting this malaria certification at the bottom left, and Patrick will tell more about, after my presentation, about how this climate data has been used in DHIS2 and also combined with health data. So as mentioned, also we have these two apps so far. Just to stress that the climate app is already installed. Everyone can install it. It's available on the App Hub. It's already used in production. while the chat modeling tools, we have these 10 countries that we are working closely with, and we'll continue to do because before this becomes like an open product. The climate app also, it's very easy to install. It's just to go on the App Hub and install it. What you need in addition is that you need to have access to Google Earth Engine. So currently this is a requirement to use the app. We will make it an option later on when we add different data providers. But currently you need to have that. And if you already have access to these Google Earth Engine layers in Maps app that we have had for 8 years, it also works in the climate app. So then you need to do nothing. But the sign-up process is now much easier than it used to be. It's based because we can give you access on behalf of Google. So you just send us an email and we will give you access. But this is only for non-commercial use. So that is important. We can only give you access for non-commercial use. So these are the data set we currently support, as mentioned. But this is just, there is so much happening here, and even more will happen in the next couple of years. There is a lot of technology advancements, new ways of integrating this data. There are new types of satellites. And so the only thing we can do is just to try to build an open platform where we can easily include new data sets. So I think this climate app and the work we're doing will be constantly changed. And that's a good thing with having this continuously release on the app hub, is that we can release very often. When there is a new service available, we can add it to the climate app and make a release, and you can just download the latest update. So it's great that we now have this pipeline of working. Also, as mentioned, we don't want to force any of these global products on you, even though maybe the local data is not always better than the, like there can be gaps and there can be, but there is a value in itself to use local data and to get this collaboration going and getting the countries much more like being able to operate this themselves. So that's why we have this custom data. So I know Nepal has already looked into, because they have this great variation in altitude. So even within the same district, there might be 6,000 meters difference in altitude. And then the ERA5 dataset that we have with 9-meter resolution, it's not really good enough. So they have looked into other sources with a 1-kilometer resolution. And we really encourage you to do that, but we still currently need to get that data into DHIS2. So we are more like building a pipeline now for custom data that we also, for example, can use with the Cicero data set, with the not the Cicero, but you saw the PM 2.5 air pollution for Sri Lanka. We will also have a pipeline to get this into DHIS2 also. And also on the air quality, you saw this, that there are some station data. It really varies from country to country. But there are getting more and more of these air monitors. They're also getting more low cost. So we are also, some of these that have open APIs, we will also try to integrate into the climate app. So you, for example, for a health facility, you can get the closest air quality monitor displayed on your dashboard. And in addition, there are some global data sets that measure air pollution from satellite, which was also used by this Sri Lankan use case. To sort of get a continuous surface. So, and this is called CAMS, and we also plan to add that. You saw this with the grid data. So currently, this is what we are looking for, to have grid data. So if you have grid data, we have a pipeline to harmonize this data to the health district and get it into DHIS2. So if it's not supported in the DHIS2 app, just reach out to us and we will try to help you with this harmonization process. So this is the interface of the climate app currently. There is even one more. We also have had the land cover on top there where you see data selection. So I think why it's been downloaded 4,000 times the last year. And one installation is for an instance. So it's been a lot of requests. We also see it with the sign up for Google Earth Engine. That's how we also get a little feedback. So it's been very popular. And I think part of the reason it's been so popular is that it automatically gets you climate data on the fly for your own health facilities and your own districts. So when you install the app, you will see your org unit hierarchy available, and you just click on one of the org unit hierarchy, and then we fire a request to Google Earth Engine and gives you back that particular climate data for that district. So we have two options here. You can either just look at the data without doing anything else. You click on the Explore, and then you can just look at the data for your health district in the district interest. In addition, we have the Import Data tool, which then imports that same data into a data element in DHIS2. And then you can access this in all the analytics apps and combine it with health data. It also becomes available for the chat modeling platform and so on. Yeah, so you can see the different data sets at the top. In this climate app, you can switch between monthly and daily views. So this one shows the daily. And then you can also set the start and end date. So you can look at just 1 month, or you can look for multiple years. So this is the temperature. I also showed this last year. Just then to stress also, because we're talking about climate change, and a lot of this variation is just weather. So, but the good thing with these global data sets is that we have the long time range. So the ERA 5 is called a reanalysis data set. So they use the same sort of models they are using to predicting the future. They use the same models to go to look how the weather was in the past. And the good thing with the past is that we have a lot of observations. So often these models are quite good in going back in time, because at least we have observation data that can be aligned with the models. So, and often we talk about this or the climate normals. So when we look at climate change, we often need a time range of 30 years. And currently, this what is considered a climate normal is changing every 10 years. So currently the period is from 1991 to 2020. So that is like the baseline for the climate. So in the lower graph here, you can see the temperature for 2023, and the dotted line is the normal temperature for every month for this average for these 30 years. And then you could see that the actual temperature for that month was for 11 out of 12 months, it was above, quite far above the average. And we know that we have had record high temperatures in the last few years. So I often recommend to look at the normal temperature, because the temperature itself is maybe not so interesting, but to see how it differs from the normal. And you can also see here we both show the average temperature and also the min and max range. So the max will often be during the day, and the mean temperature will be during the night. Same with precipitation. So you can see here month by month, and you can see compared to the normal precipitation. And here you can also do multiple years, so you can sort of see from the graph how this rain season has been for every year, when it has started, and how intense it has been. When it comes to the daily, especially on these global data sets, you might see quite a bit differences. They might be better on the monthly average than going day by day on precipitation. We also added the humidity. And this one is more of a little bit more complex graph, because we're also showing the relationship between this, how the relative humidity is measured as a factor between the air temperature and the dew point. And again, I think for a health worker to look at this has little value. So that's why we're stressing this with the climate services, that this needs to be adapted to the audience. And one thing we have been using this with as like a covariate is with the chat modeling platform, that this might be able to help predicting malaria or vector-borne diseases. Heat stress, this is from one of the worst cities with heat stress from Delhi. And especially also with the combined with air pollution, we could have some really bad health effects. So maybe this one is the graph that we have that is a little bit like connected to health, because this is a universal index which has these categories of how this is felt on the body. So that is how this compares to temperature, is that this also take humidity, radiation, other factors into account to see the actual felt temperature on the body outside. So we could see here that it's going into the extreme heat stress category above 46 degrees for some days. And that is the daytime temperature, not the average temperature. Since also we have these long time ranges, you can also see how the temperature is changing. We see that there are some misinterpretation of this graph, that some things that this blue one is minus temperature, but the baseline is this 30 years average that I talked about. And then for every year, this month, this is December, it shows if the temperature was below or above that average, 30 years average. So the thing this one shows is the trend, the global warming trend. And also depending on which 30 years period you select, so you can select between two. So this one is the one that is recommended for looking at the climate now. But to see the long-term climate change, you can also select the period back to 1961 to 1990, and then you will see a much more clear warming trend. So this is one of the new data sets we added. So this we saw in research literature, especially this NDVI, the Normalized Difference Vegetation Index, is referenced a lot when it comes to this malaria prediction. So this shows something about the greenness or freshness of the vegetation, and it varies throughout the year and also from one year to another. The good thing with this data set is that we have it for 16 days period. So, and it's also, the resolution is 250 meters. So it's much more detailed compared to the climate data, which is 9 by 9 kilometers. So we haven't really tested this into the chat platform, but it will be interesting to see how it will influence the predictions. So this was 16 days period. So we don't operate on 16 days periods in DHIS2. So we have to either, you can select between to go to normalize this data either to weekly or to monthly. And you see that the weekly, we're just using linear interpolation here, but you see that the weekly corresponds very nicely with the graph of the 16 days, while we're taking some shortcuts on the monthly data. So if you have, this also depends on the health data, if you have that weekly or monthly, but from this, we recommend to import this as weekly data. We have also added land cover data. So you have had this for some time in DHIS2, in the Maps app, but now you can also import this data with the Climate app. So this is just an example for Kathmandu. So you can see that the croplands, this has gone back to 2002, went up to about 30% in 2004, and then it's been climbing, and now it's currently 22%. And if you look more closely at the data, you will see that the urban and build-up areas has been, so basically the cropland has been urbanized during these years. This data so far we only have for per year. So I'm not sure how well it can be used in the modeling platform, but we will also try to get this more so you can see changes within the year, and especially when it comes to wetlands and so on, that might influence the. We've also added elevation data. We got feedback, as I think you will mention it, especially for like a country like Nepal and also Ethiopia. This has an important factor in where the malaria or mosquitoes are breeding. So we have also added this. Again, you can compare it with the Maps app and also in the Climate app. So often when we import elevation data, you just can import the mean elevation, the mean, or the max. So it's basically for a whole district, you end up maybe with one mean value. So we just added this graph here so you can see how sort of representative that mean value actually is for that district. So here you will see it's a big area at around 1,300 meters, which is the Kathmandu Valley. You can see with the same color there on the map. Also, as you mentioned, we have added some app settings because so often we saw that we would like to compare these charts or districts with each other. So just being able to make sure that you're having the same y-axis was important. So you can do that under the chart setting. And especially, for example, when with the heat exposed threat, this goes from extreme cold to extreme hot. And there is a few countries where maybe Nepal actually have the full range, but for many of the countries, you are only, for example, on the heat range. So you can set the minimum and maximum, and then if all the charts will align if you compare it like this. So in Nepal, we are looking at 4 different districts from the lowland and up to the mountain. We have also improved the setup guide. So the setup guide was getting quite verbose. And especially now when we have added all these new data sets, I don't think land cover or these are interesting for all of you. So now if you go to the setup guide, you basically select the data you want to import, and then we give you the setup steps for that particular indicator. So this is an example for the heat stress, which also shows you the recommended legend. We have thought about making this, in the beginning, we thought about we could automate this process. So you can just push a button and then all this will be created. But then we also got the feedback that actually countries like to have this extra control, that we don't do it for them. And often we're also afraid that you end up with a lot of data elements in your database. So far we make this recommendation, and it should be very easy to follow what you should do in the maintenance app. One thing also we learned is that we see that this store 0 data values is off by default in DHIS2. And we learned that that means if there is no rainfall, you have no value. And that was getting a little challenge with the chat and the modeling. So actually for the climate variables, you should always make sure that that is checked, because we want to be sure that it's not missing data, it's actually a day without a rainfall. But this is also then written in this guide. And then we just one slide on the import interface. So this is how you import the data into DHIS2. So you select the data element, you select the period type and the start and the end date. And then you select for which org units you want to import the data. So here I'm selecting one district, Bombali, and then I want to import all chiefdoms, the level below that one. And then if you have followed our setup guide, we have provided some codes. So the data element in DHIS2 will automatically be selected if you have followed our setup guide, as you need to search for the data, the right data element. Yeah. And then also as a repetition, we always will try to get the best data available. And this is also responsibilities for the country. So this one, working with the local Met offices, having local data, it's something they have made their API, so we just need to make this connection. So hopefully within a few months, this will be available in DHIS2. But also again, you need a special permission. So you need to provide like a token to be able to connect to this service. But I think this will be a new and a nice add-on to have much more local data available for the countries. So I will hand over to Patrick for some use cases.
Yeah. Should be. Can you hear me? Yeah. Okay, so thank you so much, Bjorn, and it's really a pleasure. Yeah. So coming from the data import, it has been a bit challenging for us to start looking at something within the DHIS2. And so different countries have, of course, come up with different ways of starting to look at this data. But of course, for Uganda, being someone who's like supporting the regional implementation role, we've had to think a little more creatively on how we can start looking at this data. So what I'm sharing with you is basically a test instance that we've been able to have access to with the approval of the Ministry of Health in Uganda. They have allowed us to do a lot of testing where we do the development and then we're able to deploy this. So what I'm showing is basically a test instance. So don't quote whatever you see here. Yeah. So the dashboard that I'm showing you is a dashboard that after data has been imported into DHIS2, we start to see how can we analyze this data. I think that's better. Sorry. Yeah. Okay. So how do we start analyzing data? As the DHIS2 implementer, whenever I get data in DHIS2, I start to look at the tools I have within the platform, start analyzing data. So in my head, I'll be thinking about the charts I have, the maps I have, and the indicators I have. And so that's really what we're trying to do here. Without modeling, what can we do with the climate data that we have in the DHIS2? So some of what we've been able to do is this kind of climate profiling. As you saw in the climate app, you are not able to kind of look at maps, but also look at for a longer period of time. So when we import data in DHIS2, we can come up with this climate, kind of calling it climate profiles for the different districts. So as you can see here, this is the precipitation. You can at a glance know which areas in the country is probably has more rainfall in the year cumulatively. So you can see like within these areas. And so someone who is now thinking of some interventions, at least you have that in mind. And we use this feature where you can look at how does the year before compare to the current, how has things been playing out. So these are some of the things that we've added. Same as for temperature, we've also been able to put this so that you can understand maybe which areas warmer than the other. And same thing with relative humidity. And then also, of course, the vegetation index. So this is one little aspect that we've been able to add. And I think one may think is not something very important, but I can imagine if you're a health practitioner at the district level or at a national level, starting to look at this, I think gives you a good understanding of where you probably want to focus with your intervention, more so if it's a climate-informed intervention. We've also done some basic trends of malaria we started with precipitation. Again, this is not really the best. We really would want more advanced, but again, someone just appreciating and understanding the kind of relationship or the kind of trends that or patterns that you're able to see when it comes to malaria and precipitation. I think anyone can actually see that something is playing here. And you can see the red is the precipitation. If I turn that off, that is the precipitation. And then when you bring in some trends of malaria, and we did this for one of the regions, you can see that there's something happening there. Whenever you get an upsurge on, whenever the precipitation go high, you get an upsurge on malaria cases. We did the same with the relative humidity, as you can see. But again, this was like the first part of looking at this. Then we also learned, of course, with the implementations that has been happening, and it was mentioned a lot of work that was done by the ENACT initiative that was looking at creating map rooms with metrology, and there they are looking at climate service for health, and for health they had some dashboards that was looking at malaria data specifically for health. They also had something on agriculture, but for health they have this indicator that is called climatic suitability. And this indicator is something that they implemented in there. So we've been able to get that and also bring it out here. So basically, the way this is, and it's really based on literature, we've been able to put it here so that one can reference that it's known that for the vector, suitability for the vector, there are certain thresholds. You have precipitation within a certain threshold, temperature within a certain threshold, and then relative humidity within a certain threshold. So again, using the DHIS2 capability of indicators, we've been able to configure a composite kind of indicator that combines all the three parameters and within those specific thresholds. So if you see a district that is in red, it means that all the three parameters have been met, meaning that the precipitation, relative humidity, and temperatures were within a certain threshold. And that makes that district, of course, at risk if you are to consider the climatic conditions. So if you see a district here in a given month, that district will be at risk, meaning all the three at high risk, all the three conditions were met. And for this, again, you can use the DHIS2 maps to be able to kind of look through to see how the months kind of played out. So you can see in a given month, if your district could be on or at high risk, meaning all the conditions were met. And there are months where you see most of the district are at risk. Of course, one will say, how do you use this data? How do you use this risk mapping kind of data to do what you do with it? And some of the things that we're looking at least now they know where each district could be at risk in a given month. And so if you factor in lag, you could do some interventions ahead of time because you know the district was suitable. And so if you factor in all the other things, then you could maybe ahead of time be able to intervene. We've also done this to look at, if you look at the whole year, yeah, how many times was a district suitable? And so with this map, you see, we are looking at the whole year of 2024. How many times was a district suitable? And you can see the districts here. Some of them are 7 times suitable, meaning that the 12 months, you have a district that was 7 times suitable, meaning that that district is really a high-risk district because by these climatic conditions, definitely you'll have a vector and definitely you should be able to. And I happen to come from one of these districts where there's a lot of intervention of malaria, and it's not surprising because the conditions there really favor the vector, and then you're able to get the high cases of malaria. We also looked a bit on, so if you look at a district and just look at the cases that were reported for a given district, and I'll just maybe do a full screen of that. So if you look at the bars being the suitability, so, and then the cases being reported for a year, or span of a year. So here you can see from January to December, and here we're looking at just one district, the cases that were reported there. So again, this kind of communicates on how this suitability really relates to the cases that are reported. You can see in the beginning, when it wasn't suitable, the cases were really low, but later it started, and then it went up and was sustained and kind of went down. And this also kind of communicates the seasons of malaria that we have in country for some of these districts. So like for this district, they have 2 peaks of malaria cases, this one and that one. And you can really see how it's so much dependent on the climatic suitability. that are in that district for that period of time. Then lastly, we've also tried to look at this side by side, where you're looking at the suitability for a given district and also the cases that are reported. And here we're looking at a case per 1,000. So again, if you look at this on this table, you can see in the beginning, the cases are low because suitability is a bit not at high risk, but slowly as the climatic conditions get suitable, you see the cases really going up. So this is one part of what we've been able to do. And I really want to thank the ministry for allowing us to use this. And we think this is one way of starting to look at this climate data when you import into the DHIS2. And then, of course, the complex part is really modeling. We've also been able to set up the modeling here, but for this demo, we just wanted to show a bit of this. And then when we did this and demonstrated it, Maleke from Ethiopia said, no, we could also start from there. So he has something very similar. He has been able to pick some of these ideas, and we are trying really to propagate this idea. This same, what I've showed you, we have a demo on the DHIS2 demo. If you have access to demo instance, you should be able to see some of what we've been able to, including how we've been able to configure these indicators and some of this visualization. I think at some point we'll share a link, but for those who have access to the DHIS demo, you should be able to see some of what we've been able to do. But over to Maleke to.
Yes. Yeah. Thank you, Patrick and Bjorn, for the lovely presentations. I know there's a short period of time, so I'll try to be as brief as possible. So what happened was during our Thursday meetings, we have a weekly meetings for all the 10 countries. So we saw the Patrick presenting the suitability analysis for them, and because there's also a high burden of malaria in Ethiopia, we wanted to use that into the Ethiopian context. So what we did was we went into the test instance, we asked Patrick, and then we tried to implement that into our system. So the challenge that we had was the factors were not really the same. Now, for them, it was 0 and 1, but for us, they wanted these between 0 to 100. And then it's not really a binary. So they wanted to see the effect of each climatic factors. So we couldn't just import it, but what we did was we learned from the Ugandan instance and then tried to implement it in the Ethiopian context. And then while we were implementing it into the Ethiopian context, we showed it to the ministry, but then they said, you're considering the whole country as a single instance, as a flat land, but it's not flat. So what they said was, we needed elevation. But at that time, we didn't have elevation. We tried to import the elevation ourselves from maps, from different instances, and then it was becoming a headache for us. And then during those Thursday meetings, we asked, I remember Bjorn, and everyone was there. We told them that elevation is a big deal in Ethiopia, especially when we do stratifications, because we have lands which are above 2,000 meters. And in those areas, the mosquito is not able to breed. So that mosquito, because they are not able to breed, it doesn't spread well. But when we have low lands, like in the middle, between 1,000 to 2,000, that's a very suitable place for the mosquito to breed. So that elevation caused a huge factor within our stratification. So that stratification, we talked to Bjorn, and then he said, we already have it in maps. I think it's easy for me to import it into DHIS2. And then I think it's after 3 weeks or something like that, Bjorn added the elevation data. So once the elevation data is there, all the climatic factors that we need were there. And then we could have such a map if you look into it. So this is the Ethiopian map. So at every district, we have all the climatic factors separately in different dashboard. But at the same time, this is the compound suitability where we have precipitation, temperature, elevation, and humidity to it. But then the interesting fact that we have seen, especially when we looked into the Ethiopian condition, is that even if the climatic factors are not really suitable, then there is also imported cases that come into effect. So now we are working with Beyond and the others to have this population index where if there is a lot of movements, even if the mosquito is not able to breed, there will be a lot of malaria cases. So these kinds of data, we are still working on it. But for now, the good thing about this suitability is that before it used to be around to take a whole year or 2 years to come up with this stratification on a random basis. But now the advantage is we can just do it in months, we can do it in weeks. Once you have the structure there, once you have the coordinates there, then it's just about importing the climate data, keeping it updated, and then you have the stratification. The good thing about doing it in DHIS2, which even the ministry were really appreciated, was the malaria team inside the district, is that we can also have the previous history of the malaria cases, which is already in DHIS2, aggregated, and then import it as a stratification parameter in addition to the climatic factors, because that's also a big deal in Ethiopia, which is we have asymptomatic malaria carriers who don't really show the symptom, but if the mosquito is there, they can just transmit the malaria. So that's something that we're currently working on. Of course, as Patrick mentioned, this is still on the early phases and it's more on a research area, but it's really showing to be an impactful area. I think that will be all from my side. But if you have any questions, please keep them.
Thank you both. We have some time for some questions, if there are. Yeah, I will try to. Okay.
Yeah, don't hold the mic. Can I just use down there? I have my running shorts.
Thank you very much for this fantastic presentation. I don't know how recent your work was, but my question would be. Oh, sorry. Do I have to repeat myself? Okay. So thank you very much for these fantastic presentations. I don't know how recent your work is, but my question would be, do you have any concrete examples of the Ministry of Health, in this case, maybe the malaria program, taking action in adapting their program, or is it too early for that? But I think it would be really interesting to start, taking note of concrete actions, use of their analytics to improve health programming. Thank you.
Okay. Yeah. So yeah. So for what I've been showing you is something that we are in final stages of getting it out to be really used at even district level. So for Uganda, we're looking at post malaria. I didn't show the nutrition. There's also work going on in nutrition, and we're also looking at NCDs. So we're looking at the 3 programs at the same time. But we thought this was a bit more mature in terms of the input, but also it's a bit more informed with a bit of research and something that has already been there. So it's really for us out and ready for us to roll this out. We've had some kind of iterations with in terms of agreeing on the thresholds, because as you can see, it is a bit depends a lot on the threshold, agreeing on what is there for that country. Yeah. So we've kind of agreed now, and we have something, and we should be able to roll out. But where I see them really using it is first, understanding which districts probably would be of priority, as I've showed you on the map. I think that can really inform kind of being more targeted in where they would want to intervene. If you look at the map, some of those districts would be the condition could be favorable, but it's a forest. Yeah, so there are those districts where they have to now. I think that's one thing that they could look at. But I'm also looking at this as more of validating, like for instance, if there's been intervention for those districts, there are a lot of spray that happens and all these interventions. Just being able to know that this district is a high-risk district, but with the interventions, we've made intervention, and indeed we are looking at the cases not as high as maybe it should have been. So in a way, this can also kind of help to validate some of the interventions, whether they have been impactful for some of the districts. But then also a bit of more early warning. We are still think that this can help. If we are looking at this maybe on a weekly basis, yeah, if every week you're looking at which districts are suitable, maybe you could ahead of time quickly intervene. Yeah, so but next year we'll be here telling you the stories of how this is changing our communities.
Person here.
Hi, thanks for the presentations. So we are looking at setting up the climate data app in the Caribbean region. And so I have two questions about that. The first one is, in the Caribbean region, the health data is typically captured using EPI weeks. And I know that the climate data is weekly, which may not align. And so have you ever handled or dealt with that situation, and how would we approach that? And the other question is for managing the local data, because I've learned now that there are more data sources, but when we did do some comparative analysis of with the Met Office looking at the data, it was not accurate within the Caribbean region states that we looked at. And so there's a project now to integrate the local weather station data into the climate data app. And so the local data module, when and how would it become available for the Caribbean region?
Very good questions.
So for the climate data, we currently have this ERA 5 and the CHIRPS for precipitation. It's on actually the ERA 5 is known to overlay, but it's daily data. So that's why we started off with daily data, because that could be aggregated to any period in DHIS2, also EPI weeks. So you should be able to do that. But also another thing to note is that if some of these island states are quite small, so you might have some difficulties with the ERA 5, but it would be to actually get the value for all the areas, but as it's close to the coast. But it would be nice that you actually try and give us some feedback. There is also another ERA 5 dataset. We're using the ERA 5 land, which is 9 kilometers. There is another ERA 5 that is also covering the ocean, but that is only 30 kilometers resolution. So there are some other options. When it comes to the local data, so we are only supporting now this ANACT initiative, which is mostly in Africa. I think they had a few more countries, but then we could give you in touch and see if some of, at least all their tools are open also. So you might be able to use the same approach as they are doing to actually improving the local data you have to fill in the gaps.
Yeah, thank you very much. I'm glad to see that you added education and some of the other environmental indicators. One thing that I think we may be missing, we could discuss, is flooding data, because it has some very good effects, when it comes to malaria, some of the vector-borne disease, malaria, dengue, and all of that. And I believe that with Earth Engine, we can use either the required for the shared data with land use, if we really want to model flood properly, not just use elevation, but then add all the land use to where we can use that and then add as a covariate, in our modeling and all of it. I think it's a very good so if we can probably think about that. So,
I could mention that one of our 10 countries, Laos, is looking into floods, and there are some global data sets available, but some of there are also they are looking at the Mekong River, and also by the river there are are more detailed data sets available, and they have also have a proof of concept of importing it into DHIS2. So basically, it shows you the high risk. It's a forecast, and when you plot that in the maps, you will actually could see the health facilities that could be at risk.
Thank you. Well, I don't know that you understand my question, but when you don't understand, I will tell my colleague that is new. I know that those applications read the really temperature times. I know that, for example, I want to the central capital, and then I want to read the temperature for one district. I would like to understand we have a factors or that contribute to the end temperature for the. I know that I said that in central capital, no, and then I would like to read the temperature, real-time temperature for end districts. I would like to understand those temperature to read for district is the real results, or would have some factor to contribute to read a real temperature.
We could try. So for this ERA 5, it goes and ships, it goes back in time, and sometimes I think the lag is often 1 month. So this is really to analyze the past. But then if you go into the climate app and you select a health facility, you will see real-time weather forecast for that health facility from today or right now and until 10 days into the future. So we have this data, and also I think this is also something that the National Met Office could provide, and we might help to integrate. But we are, so currently we have a 10 days forecast. The thing is that this is only for single locations, so we can't go to the district. But if you select a health facility in the climate app, you will be able to see this 10 days weather forecast. So try that. And then we are looking into seasonal forecast and so on, as mentioned before. Yeah.
Okay.
Would you say add?
No, just maybe a small comment on in terms of how we want to analyze this climate data. I don't know if it is the idea of looking at a health facility and probably trying to get the climatic condition of that health facility. For now, what we've been thinking is really more looking at the whole district and not just one point location to do your analysis, but looking at the whole district. And that's why with this data that we've been importing for the whole district, so that you look at cases in that district and climatic condition of that district, and not this one point health facility, because people who go, if you seek services, you could move from any of this. So it's better when you look at the whole area. I think it makes a lot more sense, if I understood what I was trying to ask.
And I also agree, and I think this also comes back to the use case.
Yeah.
So there could be, for example, with air pollution, heat waves and flooding, maybe looking at the health facility might be reasonable, because you can do some extra actions if you know there's an upcoming heat wave or flood risk. But yes.
Okay, I have a question for Patrick and Male. Thank you for your presentation. The first one is for Patrick. I understand Uganda is not comparable to Ethiopia in terms of the elevation.
Yeah.
But is elevation not an issue in Uganda? But I understand there are some parts like the south, west, and the western areas that are altitude areas. So is that something that we will consider for the future, or something that not so necessary? Then for Male, I just wanted to understand, you said you benchmarked on the use case for Uganda, where we used precipitation, humidity, temperature, plus elevation. I just wanted to confirm that those three were considered, but also elevation.
but the thresholds are big. Maybe I will answer.
Yeah, so already Malek was saying, so the idea of this, the first thing is to agree on those thresholds. It varies from country to country. But also I would think that it will vary from the level at which your program is, because there are programs that are really focusing on elimination. So they're a bit more maybe strict on trying to get as much, yeah. But if you are still on control like Uganda for most, you probably want to make a threshold that is not very open, but a bit of threshold that really gets you what you need. So in terms of tailoring the threshold is very important, as we are. So from the literature, they have a different threshold, but of course the guidance is that you should be able to tailor to your country need. And these are some of the things you need to agree on with the program. Yeah, for now, for Uganda, we considered only 3 parameters. We will look at, we'll also think of, as we start to roll this out, we'll also look at those districts that have high elevation. We have one of the tallest mountains in Africa. So yeah, the Rwenzori, we have Elgon, we have a bit of mountainous areas that we need to look at this. So as we get it out, I think it is one thing that we need to look into, the elevation. For now, we've not.
Thank you.
Oh, sorry, just one comment. First of all, I was trying to identify my Caribbean areas, there's Quito down there. So just with regards to some of the climate and health modeling work that we're doing in the Caribbean, COFA in conjunction with the Barcelona Supercomputing Center over the last 5 years or so has been looking at a few pilot states in the Caribbean, remodeling particularly climate and dengue early warning systems. So yes, our approach is a bit more of the older approach, where we're looking at the individualized country data, combining health and net data, etc. With respect to the area of low resolution, what we've had to do or work with rather in terms of the climate data is that we will work with the local MET stations, but on the very tiny islands. Sometimes the weather stations, you may just have one in the south of the country and one in the north of the country. So in order to get better data, we've also tapped into the Ministry of Agriculture, the Ministry of Water, because sometimes they have their own automatic weather stations that you can also tap in and get their data as well. But what do you need to evacuate? Okay, so what I just wanted to mention is that in terms of our approach, we are looking at DHIS2 and eventual migration hopefully next year or so in terms of what we've been building. So that's what the COFA has been doing. The work that PACO has been doing is a little bit more focused on chat application and pushing that forward. So COFA and PACO are working together as closely as we can to determine how best we can integrate within the next 2 years or so that we have a unified approach and a model for our Caribbean countries. So just wanted to give that bit of input.
Yeah, thanks for that feedback. I really hope that we can learn from each other. And we also see that there are so many initiatives and people are finding good ways of overcoming these data gap issues. So it's crucial that we try to avoid double work and cooperate, and maybe these solutions can be shared. And sorry, we need to end the session. Yes, but there is another session after lunch on the chat modeling platform. And then also we have a full hour with the expert lounge from 4.
The chat room is 3 o'clock, and there's also a panel session, I think at just after lunch, also with the presentations from Mozambique and other places on this climate network. And I guess you can ask your question first on there. So thank you so much. A big hand to all of us. Very good presentation.